The Kaiser Family Foundation presents health08.org, election news, analysis, and events.
Bill Novelli from AARP, thanks for joining us on health08.org.
Thank you.
As everyone knows, the organization represents people 50 and older, so they're either on Medicare or about to be on Medicare. For many people in the association, their financial security is linked to what their health care costs may be. So through that prism, what does the association see as the most pressing health care issue out there at this moment?
I think there are three. First of all, the spiraling costs. And these are costs that are hitting everybody, not just employers, not even employees, but everybody, all families across the country. So cost is probably the big thing, and it's really going out of sight. And then the other two, of course, are the huge numbers of uninsured that we have in this country, and then the quality of care that in many cases is actually going down.
A while back, AARP helped found Divided We Fail. Is that the cornerstone of the association's approach to what needs to be done next?
Divided We Fail is a cornerstone for us. We started off by saying that the two biggest issues that we really have on our agenda are health care reform and long-term financial security. Both are big problems, and of course they're connected. I mean, you can't have financial security unless you have adequate health care. And so we decided that the best thing we could do would be to start a movement, nothing short of a movement. And we began Divided We Fail, and we now have three major partners. The Business Roundtable, consisting of the CEOs of America's biggest companies. The National Federation of Independent Business, which represents medium and small companies, where most of the jobs come from in this country. And then the Service Employees International Union, SEIU, is the fastest growing labor union in North America. And we've been called strange bedfellows for a reason, because if you
I was just about to say that.
Indeed, if you put business and consumers and labor unions together, they don't always see eye to eye. But that's our coalition, and we've got a set of principles to which we agree. And we've basically said the only way to achieve our common goals is to work together, and we'll arm wrestle later over the details.
But at the 10,000-foot level, you do all agree on the same principles. But isn't it when you get into the weeds that the real hard stuff begins?
Yes.
And have you started discussing that with these strange bedfellows?
We have. We're working on all these different issues, and we're basically saying, where can we find common ground? Sometimes it's easy. For example, we all work together on the state children's health insurance program, because everybody believes that we need to insure our kids in this country. Another example of an easy one is health information technology. Business wants this. Labor wants this. We want this. We think it's going to make a big difference in terms of quality of care, reducing medical errors, and saving money. But there are other areas where we're not in agreement, and the idea, though, is that we can work it through. We can work together. We can find that common ground, and truthfully, so far so good.
Well, what are the areas where there is no agreement at the moment? I'm guessing it's about how to bring down costs in a more significant way than IT would, for example. Is it a single-payer approach? Is it maintaining the employer-based approach?
Mm-hmm. Well, there are some instances. Let's take, for example, the single-payer approach. I mean, there are some among us who probably would like that, but don't think it's politically realistic. And so that hasn't been a sticking point for us. Nobody's going around saying single-payer, single-payer. People tend to say, and I'm talking about my partners now as well as AARP, we tend to say we've got to be realistic. Politics is the art of the practical. We're probably going to need some kind of a public-private hybrid partnership, so let's work on that. Now, one example of an area where we didn't see eye to eye was in California, where last year and then early this year, healthcare reform, real reform, was in the offing, and then it went down to defeat. And there we came into some disagreement on some areas. For example, the idea of whether or not to have an employer mandate. Now, this was not something that NFIB favored, and it was something that we thought was probably a good idea if it could really help to make healthcare affordable. So we are finding areas of agreement and areas of disagreement, but we're soldiering on.
What did you learn about the California incident where you couldn't come to an agreement in terms of what may be applied to how you move forward on the federal level?
I think we learned a couple of things. One is we learned that we do work well together. And here I'm talking about the four principals, Todd Stottlemyre of NFIB and Andy Stern, SEIU, John Castellani of the Business Roundtable, and our staffs and myself. We've learned that we actually like each other. We can work together. We can disagree without being disagreeable. So we definitely learned that, and it's kept our coalition strong. The other thing, though, is we've learned, of course, and we knew this going in, that underneath that 10,000-foot set of principles, there are going to be disagreements, and we have to find our way out of that. An example of that would be health coverage for small businesses. Mm-hmm. 2 years ago, we were in disagreement. And now we're saying, well, let's figure out what it was that we disagreed on. We all agree that small businesses should be able to offer health coverage. So let's see how to make that work. And now there's a pending bill, the Durbin Bill, where we think that we can actually come together.
And going back to something you said a few moments ago about the creation of some type of a public-private partnership, go into some more detail on that point.
Well, the Business Roundtable has said repeatedly, we don't want to get out of the business of offering health care to our employees. We think we do it pretty well. We think it gives us a certain competitive edge. We want to continue in this, but we also need relief. We can't keep absorbing these soaring healthcare costs, and we can't keep passing them on to our employees. So there's got to be some way out of this. And so one of the thoughts that we've been discussing, the four groups, has been, how can we set up a system where, you still have Medicare perhaps, you still have S-CHIP, and you still have Medicaid and so forth, but at the same time, you're coming up with some way of offering insurance to people in the individual market who need it, the employer market, and also government. How do you put those things together so that they fit? And so at the same time, we have cost containment. So those are the kinds of discussions that we're having.
And the answers?
Well, there are no easy answers, of course. But there are a lot of, here's the thing, Jackie, that I find fascinating. There are a lot of policy ideas that probably make sense and that we're sifting our way through right now. And at the end of the day, I keep thinking to myself, that's not the problem. The policy ideas are there to be worked through. The problem is the politics. The politics of healthcare is more difficult. The partisan gridlock is very corrosive right now. And we have to say to ourselves, is that going to change in a new administration, in a new Congress? How can we lay the groundwork now to get to a point where we actually do have a Congress and a new president that wants to do what's necessary to fix healthcare?